Hi everyone, I'm here today with Dr. Mary Ellen Tedeschi, Dr. Molly Sears, and me, Dr. Shreya Soni, and we're going to talk about yeast infections. So yeast infections are fairly common for women. Up to 80% are going to have one at some point in their life, and symptoms include itching, so vaginal itch, discharge from the vaginal area, and it could look white, curd white, burning, swelling, redness, pain with intercourse, and you could even have symptoms on your skin. You could have scaly patches on your skin. So those are some of the signs. If you're experiencing those, it's important to talk to your doctor and investigate if you are suffering from a yeast infection.
Yeah, and that can be, hard to distinguish from other conditions like bacterial vaginosis, which we made a video on last week, which you can follow any of us, go look at our YouTube channels or our Instagrams and you can watch those. But the symptoms can present quite similarly. Anything else on that slide, guys?
Yeah, I mean, it's important to get it treated and not ignore this itch because we don't want it to spread higher up in your system. So it's important to prevent this and get it treated early to prevent chronic infections.
Yeah. Okay. So a lot of women, like Dr. Soni was saying, are going to experience yeast infections. And of those 80% that experience it, a significant amount of that 80% is also going to experience recurrent yeast infections. So it can be a little hard to treat and hard to get rid of for good. A lot of women will notice it's coming on with their cycle or just prior to their cycle or around ovulation. Some women will get it every time they have intercourse. And so some of these causes happen because of a high estrogen state. So we see women when they're pregnant will get more yeast infections. It can be caused by certain medications. So some of them are listed there, as well as taking hormones. So again, that higher estrogen state when you're on oral contraceptive pills. Some other contraceptive devices. If someone is going through radiotherapy or chemotherapy, it's going to affect your immune system. So your immune system is going to be less able to protect itself from this yeast overgrowth. And then things like wearing tight clothing can create an environment that predisposes you to more yeast growth. Again, pregnancy, like we discussed, and then excessive sugar in the diet. So not all yeast infections are caused by Candida species, but I think it's up to 80 or 90% of them are usually caused by Candida specifically. And so all yeast, no matter what the actual pathogen is going to be fed by sugar. And so eating white sugar or heavy processed food diet or processed foods in your diet can feed that yeast. And then also if your sexual partner has Candida overgrowth or yeast overgrowth, it can be transmitted sexually, although it's not typically considered a sexually transmitted infection. Anything else to add?
Yeah, I'll say anytime you're taking antibiotics, you do want to think about putting in those probiotic species to help reduce the risk of something that's opportunistic like Candida or yeast to grow. So there's times in life when you're at higher risk for these, and then if you develop an itch, it's important to consider yeast as why it is happening.
And thinking about the bigger picture too. So if this is something that's chronic or happening monthly or every couple months, or if it's something that's happening more frequent for you, then thinking about what's happening in the gut, your microbiome, all of these different lifestyle factors that can help get you out of that vicious cycle of Candida overgrowth.
I've seen women have this itch more often right after their period ends because you're at this time when estrogen is low, your immune system is slightly low, and then you see yeast occur slightly more at that time. And there's a lot of lifestyle changes you can make to treat that.
All right, so let's talk about testing. So when you do have any of the symptoms mentioned above, or if something just doesn't feel right, it's always a good idea to go get a swab done. So a swab would go ahead and look at your vaginal secretions under a microscope. It would look at your vaginal pH and culture what might be growing. So in this case, we're looking for any fungus or the yeast growing in the vaginal canal. So what they actually use is a 10% potassium hydroxide or KOH in microscopy. And then the vaginal pH. So we talked about this with our bacterial vaginosis webinar as well. We want to keep that at less than, well, what we'd want to know is that it was less than 4.5, because that would help us exclude bacterial vaginosis, trichomoniasis, atrophic vaginitis, and that would lead us in the direction of a yeast infection instead of all of the other ones. And once again, that vaginal culture would also help us to know that yeast is in fact growing. So while it's okay to kind of rule things out based on symptoms alone, testing helps you to make sure exactly what is going on. For systemic yeast infections, so if you have candida overgrowth happening systemically in the body, in the digestive tract, we can look at this through stool or through blood tests as well.
Yeah, and blood tests, they can show us both IgG and IgMs. They can show us whether you have a current active infection or whether you had a past infection of candida. And all of that is useful information.
Mm-hmm.
Okay, so some of the treatments that we use with our patients with yeast infections, we're going to often start with a product that's often a blend of some herbal medicine. So things like golden seal, tea tree oil. I can't see what that last one is. I forget what we wrote there. I think it's garlic. Yeah, garlic. And then boric acid suppositories, which can be beneficial for bacterial vaginosis as well, but we can also use them with candida overgrowth or yeast infections. And then sometimes taking vaginal estrogens can be beneficial as well, especially in those postmenopausal patients.
Exactly. And with boric acid suppository, so this is something that here in Ontario, I work with compounding pharmacists to make a specific formulation for you that is safe to use internally. And sometimes we also blend this with some probiotics or some garlic to make a comprehensive formula that is effective to help you get rid of that yeast.
Yeah, and this would be a suppository that you insert in your vagina. That would not be something you take orally. But some of the capsules we talked about with the antimicrobials, the herbs, are all definitely things you can take orally.
Yeah, so Dr. Shrey was mentioning, when you do a round of antibiotics, it's often important to make sure you get on some healthy probiotics. Lactobacillus is the one that's most researched to support that healthy regrowth of our vaginal microbiome after a course of antibiotics. So, you can incorporate this into your diet by eating, yogurt that's rich in lactobacillus. And do you guys have anything else about the antibiotics before we talk more about diet?
I was actually going to also talk about something clinically. So another strain of probiotics that we can use if we're suspecting candida overgrowth or yeast overgrowth. So there's a specific strain of probiotics called Saccharomyces boulardii, which is actually a friendly yeast. So this is one that's really studied in traveler's diarrhea or any gastroenterology, GI symptoms, but we can also use it in the case of candida when we want to get rid of that candida overgrowth and replace it with a healthy, friendly yeast in our microbiome.
Yeah. And sometimes when you start killing this yeast, it does fight back and you experience die-off symptoms. So you can have more headaches, fatigue, even abdominal cramping as the yeast dies off. Sometimes it doesn't want to be killed. So there are things to help you through that if that is happening. There are binders that can be used. But know that, if you have a lot of sugar cravings, sometimes it's the candida that's calling for it to be fed more. And that's why you're having a lot of sugar cravings.
Yeah.
So
other systemic symptoms. Oh, sorry, Shreya. I was going to say other systemic symptoms can even be like brain fog, general fatigue, things like that.
Yeah. And as you kill the candida and yeast, your sugar cravings could come down and reduce, but initially it won't be easy necessarily.
Yeah. And so that kind of is a good leadway into our next point of eating low sugar and low processed foods, because that's going to starve the yeast and help that die off process happen a little quicker. in addition to using those antimicrobials that are helping us kill them off. And then eating a diverse diet in vegetables and fruits going to help that immune system build up. It's going to help feed all of our good bacteria. And there is even a specific quote unquote anti-candida diet that we have resources that we're happy to share with you guys. If you want, just reach out. Dr. Sherry, do you want to talk a little bit more about the anti-candida diet?
Yes, I love talking about things you can eat more than the things you can't eat. So there's a lot of foods that we do encourage you to eat if you're trying to kill candida. So, you can have as much as you want of certain herbs and spices, especially things like garlic, ginger, basil, rosemary, sage, thyme. These are all immune supportive. And then you do need to limit some of your grains. You need to limit their servings. You want to avoid rice. And then if you do have a grain, you want to limit it to about 1 serving a day max. So some of the grains that are lower in the glycemic index, so that are less likely to spike your blood sugar, those would be higher in fiber. So a rye would be better for you than eating something like rice. Or a small 1/3 cup of amarnath would be more tolerable than eating rice, because rice is going to go back and feed the candida again, because it's very high in the glycemic index and the sugar spiking ability. So similarly, you want to be very careful with pasta and tortilla. Thankfully, you can get pastas that are made out of lentils and not wheat. That's going to be more tolerable for someone who's trying to kill candida. And there's certain berries that are okay. Again, fruits do have to be limited on the anti-candida diet. So at a maximum 1 or 2 servings of fruit per day, and that also only specific fruits like blackberries, blueberries, raspberries. Those are good. Fruits that are more in the gray zone that you want to be mindful of would be a grapefruit or pomegranate or apple. Those do have a little more sugar, so you have to have less of that than usual. And then nuts and seeds, you've got free reign on. Dried coconut, hazelnuts, hemp seeds, macadamias, sesame seeds, sunflower seeds. Those are really good at keeping your blood sugar stable, avoiding any blood sugar spikes, which is helpful for treating candida. Anything you guys want to add?
Nope, that's all good. So if you guys have any questions about this or want to reach out to any of us, you can follow us on Instagram. I'm at Dr. Molly Sears ND.
I'm at Dr. Mary Ellen.
I'm at the EndoDoc.